Hello everyone. Now this is the most 17 high yield anesthesia MCQs for AIIMS INAC 2022 by me. Question 1. Regarding CPR true and false, A can be given irrespective of rib fracture. In adults, chest compression is to breath is 30:2 even if two respiratory present. In infants, ratio changes from 30:2 to 15:2 when second rescuer arrive. Chest compression at rate of 100 to 120 per minute on adults and 90 per minute in infants. If aid is available, give alternatively defibrillation and chest compression every 3 minutes. Answer is A is true, B is true, C is true, D false, E false. Criteria for high quality chest compression. Compression at a rate of 100 to 120 per minute even in children. Compression the chest at least 5 cm in adult, ideal 5 to 6 cm in adult. Allow chest recoil completely after compression. If 60 to 80% of respiration time is chest compression, best chance for a good outcome in a patient without any neurological deficit. Minimize interruption in compressions. Avoid hyperventilation, as hyperventilation increases the risk of aspiration due to increased intra-abdominal pressure. Question 2. Match color coding of inhalation agents: halothane, isoflurane, desflurane, sevoflurane. The option right option is yellow, orange, red, purple, blue and violet. Answer is halothane is red, isoflurane is purple, desflurane is blue, sevoflurane is yellow. Then pin index system. This is the common question asked in PG exams. Air is 1.5, O2 is 2.5, nitrous oxide 3.5, carbon dioxide greater than 7.5% 1.6, carbon dioxide less than 7.5% 2.6, cyclopropane 3.6, antonox 7. 1772 nitrous oxide was first introduced by Joseph Priestley. 1800 Humphrey Davy published nitrous oxide. In 1844 Horace Wells administered nitrous oxide for dental analgesia. Williams Morton public demonstration of diethyl ether at Massachusetts General Hospital in 1846. James Young Simpson administered chloroform for general asthma in England. John Shaw administered chloroform to Queen Victoria for bath of Prince Leopold. Claude Bernard discovered the effects of curare located at the mind-neural junction. Carl Kohler introduced the use of cocaine for ophthalmic surgery. And August Beer performed the first surgical spinal anesthesia. He is the father of regional anesthesia. High effect of Malamati score. Class 1 soft palate forces uvula anterior and posterior pillars visible. Class 2 soft palate forces uvula visible. And class 3 soft palate base of uvula visible. Class 4 only soft palate not visible, only hard palate visible. Then ASA status of physical status of patients. ASA 1 is a normally healthy patient. ASA 2 a patient with mild systemic disease. ASA 3 is a patient with severe systemic disease. ASA 4 patient with severe systemic disease that is constant. ASA 5 is morbid patient who is not expected to survive. And ASA 6 a declared brain dead patient whose organs are being harvesting. ASA fasting guidelines. Ingested material minimum fast. Clear foods for 2 hours. Breast milk 4 hours. Infant formula milk 4 to 6 hours. Non-human milk 6 hours. Light meal 6 hours. Heavy meal by fatty meal 8 hours. Another question asked, Asner's reflex is also called oculocardiac reflex. The oculocardiac reflex, also known as Asner's phenomenon, Asner's reflex or Asner's Dagnin reflex, is a decrease in pulse rate associated with traction applied to extraocular muscles or compression of the eyeball. The reflex is mediated by nerve connection between ophthalmic branch of trigeminal and cranial nerve by the ciliary ganglion and the vagus nerve of parasympathetic nervous system. The nerve fibers from maxillary and mandibular division of trigeminal nerve have also been documented. These apparent synapses with the visceral motor nucleus of vagus nerve located in the reticular formation of the brainstem. The efferent portion is carried by the vagus nerve from the cardiovascular center of the medulla to the heart, of which increased stimulation leads to decreased output of the synovial node. This reflex is especially seen in children, particularly during strabismus correction surgery. However, this reflex may also occur with adults. Bradycardia, junctional rhythm, and asystole, all of which may be life-threatening, can be induced through each reflex. This reflex has been seen occur during many pain facial trauma surgeries due to stimulation of any of the three branches of trigeminal nerve. Clinical manifestation of malignant hypothermia. Early signs is elevated end-tidal carbon dioxide, tachypnea or tachycardia, masseter spasm if succinyl choline has been used, generalized muscle rigidity, mixed metabolic and respiratory acidosis, profuse sweating, mottling of skin, cardiac arrhythmia, unstable blood pressure. Late signs is hyperkalemia, rapid increase of core body temperature rises by 1 degree centigrade every 5 minutes, elevated creatine phosphokinase levels, gross myoglobinemia and myoglobinuria, cardiac arrest, DIC. Then vein flow. 14 gauge is orange, 16 gauge is grey, 17 gauge is green 18 gauge, pink 20 gauge, blue 22, yellow 24, and purple or violet 26. Flow rate 14 gauge to 40 ml per minute, 16 gauge 180 ml per minute, 18 gauge 90, 20 gauge 60, 22 36, 24 20, 26 13. Minimum alveolar concentration. Minimum alveolar concentration of an agent required to produce immobility in 50% subjects exposed to noxious stimuli, that is skin incision. MAC is equivalent to ED50. MAC values can be established for any measurable response. For example, MAC awake or MAC bar. MAC awake is the alveolar concentration of anesthetics at which a patient opens his or her eyes to command, and it varies from 0.15 to 0.5 MIC. MAC bar is the alveolar concentration of anesthetics that blunts adrenergic response to noxious stimuli. Roughly 1.3 MAC in any volatile anesthesia has been found to prevent movement in about 95% of patients. Best estimates for potency of inhalation anesthesia in MAC. Most potent anesthetic methylfluorine as it has low MAC. Propofol for day care surgery. Methoxytone only barbiturate causes pain in injection. Thiopentane is a neuroprotective. Etomidate is cardioprotective. It can cause adrenal cortex suppression. Puritis is most common side effects of opioid. Rapid sequence intubation indication emergency surgery full stomach patient. Aim to prevent aspiration. Steps: pre-oxygenation, required pressure application, intravenous thiopentane or intravenous succinyl choline, positive pressure ventilation by bag and max as contraindicated, laryngoscope and intubation. Then Mapleson D or brain circuit is for adult use. Mapleson F for spontaneous breathing. Compound A is a nephrotoxis pumped by sevoflurane with soda lime. IV agent for shock is ketamine. Vecurium most cardiac stable. Atrachium metabolized by Hoffman degradation, so muscle relaxation choice in liver and kidney disease. Local anesthesia sequence of nerve block is A greater than B greater than C. Functional terms: motor greater than sensory greater than autonomic. For spinal and epidural is autonomic greater than sensory greater than motor. Recovery in reverse order. Among sensory, pain greater than temperature, then touch, then pressure, then proprioception. For CN block, temperature, next pain, touch, pressure, and proprioception. Prelocaine can produce methamoglobinemia. Legume can raise without adrenaline 3 to 5 mg per kg body weight, and duration option 45 to 60 minutes. With adrenaline 7 mg per kg body weight, 2 to 3 hours for duration. Last, local anesthesia systemic tachycardia drug of choice is intravenous 20% intrarapid. Brachial block 4 sides, interscalary ulnar nerve spared, supraclavicular most commonly used, cause pneumothorax, axillary musculocutaneous nerve spared. Then cardiac massage, infants, children, adult, pulse check, infants in brachial, children brachial and carotid or adult carotid. Compression area mid-sternum, lower 1/3 of sternum. Compression down with 2 to 3 fingers in infant, 1 hand in children, 2 hand in adult. Compression rate 100 to 120 in infant, children and adult. Compression depth 1 inch in infants, children 1.5 inch, in adult 2 inch. Ratio to without advanced airway, bag and mask, single respirator 30:2. 2 if 2 respirators 15:2. In children, single 30:2 to 15:2. In adult, 30:2 single, more than 2, more than 1 is 30:2. With advanced airway intubation, compression 100 to 120 and breaths 10 every 6 seconds. Same as infant and same as also infant in adult cases. Thank you.